Hello and welcome to yet another edition of your weekly international current affairs program, Globe Watch, on the Cameroon Radio Television with me, Charles Ebune, from the Starland Hotel here in Yaoundé, Cameroon, where we are receiving the Assistant Director General of the World Health Organization, Dr. Chikwe Ihekweazu. Welcome to Globe Watch.
Thank you very much, Charles.
One of your missions and responsibilities at the World Health Organization, which is the world's medical doctor, is to look at the situation of health emergencies globally. As we speak, what are the most critical health emergencies?
Thank you, Charles. You know, unfortunately, in the world, there are several concurrent emergencies going on. We have a number of them on infectious diseases. You know about the Mpox situation that is spreading out of DRC to many other African countries. We also have an emergent Marburg virus situation in Rwanda. But in addition to that, we have several humanitarian emergencies that are not primarily a health issue, but have a big impact on countries and the health of people. So you can think about Sudan, you can think about the crisis in the Middle East. All of these, combination of these are the emergencies that keep us very busy in the health emergencies department of the World Health Organization. You
just talked about one of them, which for our African audience will be of great concern, the Mpox. What is the situation currently on the continent?
Unfortunately, we had this emergence of a new strain of Mpox. Mpox had been circulating for a while in DRC and in some West African countries. A new strain emerged that caused us a little bit of concern and spread around a few other countries on the continent. So what we have done is work very closely with the authorities in the DRC to try and define what the situation is, working with our partners, Africa CDC and many other partners, to identify the extent of the problem, educate people on what is causing it and what is leading to transmission, and ultimately carry out some public health measures, including vaccination, but not just vaccination, that we hope will lead to ultimately a reduction in cases, and hopefully we can get rid of this altogether.
Mpox is coming when we're just recovering from the cataclysmic health consequences of COVID-19, which sapped and destabilized most economies, caused millions of deaths, eroded financial resources, and whatsoever. What is the strategy of the World Health Organization today when it comes to the management of health emergencies?
So the reality of health emergencies and emergent infectious diseases generally is, you know, every country has to have a certain level of preparedness to deal with this, to prevent, if we not able to prevent, to detect early in order to enable a rapid response. You know, the COVID pandemic was really a challenge. It was a respiratory virus, a new respiratory virus. And when you have a respiratory virus, they pose a specific threat because of the ability to transmit from one person to another. The current challenge on Mpox is slightly different. It requires close, intimate contact between individuals to spread from one to the other. So the most important thing is every country has to build a minimum amount of capacity within the country itself in order for that country to be able to prevent, detect, and respond. Where WHO comes in is in cases where that capacity is surpassed or where there's then international spread. And then we come in and support countries. So at the moment, the objective is to keep supporting countries to develop this capacity in order to do this work themselves.
And one of the ways you do that is the Universal Health and Preparedness Review component. How critical is it in the entire ecosystem of emergency management, response, and preparedness?
So this Universal Health and Preparedness Review really is such a critical part, and we learned a lot from the COVID pandemic. You know, one of the most important lessons that it wasn't possible for the health sector alone to respond to an existential threat like we saw, because it has an impact on the economy, on tourism, on education, on every aspect of the economy. So we also have to work with those aspects of the economy in order to prevent and mitigate the impacts of a crisis. Sure. So in this review, we bring together all the arms of government, not only the different ministries, but the legislature as well, the different tiers of government in countries where there are multiple tiers, to think together ahead of any event. And that's really what we have done in Cameroon over the last few years. This is a process that started 2 years ago and is culminating this week. Really bringing together all the colleagues working in the different parts of the economy, parts of the government, to think together what are our responsibilities to prevent, what are our responsibilities to detect and respond, and how can we work together around the common goal.
I understand that one of the reasons that brought you to Yaoundé in Cameroon at this, and I presume this should be your first official visit to Cameroon, yes, is to see how Cameroon has worked on her Universal Health and Preparedness Review Strategy. You were at the meetings. Before heading to the various encounters you had with government officials, including the Prime Minister, what finally did you see of Cameroon's documents?
So what we have seen in Cameroon, even before we went into the meeting, was a very engaged public sector. You know, we've seen very good documents addressing specific parts of what a government needs to work together. So I think a lot of groundwork has been done. It takes a lot of courage for a country to open up itself for a review. It's not an easy thing. This is a voluntary process. No one has pushed Cameroon to do this. So I think it's really something to praiseworthy that Cameroon has said, listen, this is our level of preparedness. We want to open it up both to examine it ourselves with colleagues in different sectors, but also open it to a global process so that our peers, people working in other countries, WHO colleagues, can come in, we can collectively identify opportunities for improvement and then work together in a plan and process to improve on the gaps that we've collectively identified.
Evaluating what you saw and what could be improved, what did you see as the salient points to help keep the public health system always alert?
Yeah, I mean, there are challenges. Every African country has a challenge of finances. We have multiple problems across society, so it's no surprise that, you know, Cameroon, just like many other countries, are faced with the challenge of increasing the expenditure on health services, right? And, you know, the other thing is, how do you coordinate the various aspects of the work being done, especially in public health? So we made a few recommendations to government to really think again on how to prioritize expenditure on health services so we can reduce the out-of-pocket expenditure on health, and so that really take more responsibility as a community, as a public, on how to fund health services. This is actually a recommendation that came from within the country, from colleagues working and recognizing that while it might serve some purpose to have different disease control programs or targeting different health priorities, coming together to build an agency, one institution that will manage some of these things together might be a good idea. And it's a direction many other African countries are going in.
You met with top government officials, including the Prime Minister. What message did you bring to them during this period when it comes to issues like the universal healthcare coverage, when it comes to emergency management? Cameroon should have one of the most effective systems that functioned during COVID-19 with very limited deaths, and I'm not saying that the financial fallouts were not colossal. So what message specifically did you bring?
Charles, I think the first thing to say is that I met a Prime Minister, Chief Joseph Ngute, who was really engaged and really understood the nuances of the health sector. And it's not in every country where you have a head of government that really understands how the different parts of government work together around a national priority. So first thing is to say we met a fairly open door, really an opportunity to engage really strategically around the challenges and priorities. I had a very good conversation with him. So I think we left that meeting understanding, yes, Cameroon has many challenges, like many other countries, but you have an engaged government that is ready to listen, ready to analyze its own circumstances and challenges, and ready to act on them. So out of this UHPR process, we expect a good report that will be shared and presented, and I'm confident that the Prime Minister and his cabinet will act on the findings and take the country forward.
Well, you have the health map of the world with you. You know where the diseases are more dangerous. You know what the world is going through in terms of health. Let me limit myself to Africa. When you put the African health map on the table, what do you think are the most urgent issues to handle? Health infrastructure or what?
Charles, this is really a challenging question, but let's put it this way. We have an incredibly young continent, right? And we have,
in terms of its population.
In terms of its population.
Yeah, plus 600 million young people out of the roughly 1.5 million people in the continent.
And what is our biggest strength sometimes can be our biggest weakness. The continent is growing. The population expansion is growing.
Well, I know where you are heading to, HIV and AIDS,
maybe
or
not.
sexually transmitted diseases because of the active population.
Maybe not, because it's a collection of issues. If the population grows too quickly for a government to provide health services for its population, you don't reap the benefits of that population growth.
Okay.
So I think there are many challenges. If a virus were to choose an environment to emerge, we have a big population in the middle of the tropics. So there are many challenges that we face. We face socioeconomic challenges and many challenges to grow our population. But I think the young population on the African continent is actually an opportunity for us to face the challenges that we have head on. Keep ourselves alive. I know in many countries, people get excited about big infrastructure projects, new airports, new bridges, roads, all are well and good. But the key thing is to enjoy all of that. We have to be healthy and we have to be alive. So I think what the message to the government of Cameroon today was, yes, health is already on your list of priorities, but it might benefit all of us just to keep it there and to raise it even a few notches higher in the thinking of how we lead our people.
In a moment, the interview will come to an end. I understand perfectly what you are saying. Currently, we spend roughly $4 billion of African health budgets. The continent needs roughly $26 billion yearly. If you were to provide or to advise a model of alternative financing to bridge that gap, what could you put on the table?
I think every country has to define how it will raise the resources to support this sector, right? But there are different models. You can talk about taxation or health insurance, and all of them have their value, right? I think the key thing is, how do we maximize the opportunity that the economies of our countries present, and make sure that the money, every dollar we spend on health, is spent efficiently. We have many challenges. We're losing our health workforce because colleagues are traveling to countries to work that pay them better. Many of them are funded, their education, their training is funded by the public sector. So there's an opportunity there to titrate that challenge a little bit more. There's a challenge of how much we spend on tertiary versus primary health care. So there are many areas where we can think and use the opportunities and the knowledge and the emerging thinking around health financing to drive more efficiency. And let me end by saying, a few years ago, African countries came together on their own in Abuja and declared what is now generally called the Abuja Declaration, and promised themselves, this wasn't a WHO initiative. African countries came together and promised themselves to spend about 15% of their annual budget on healthcare. Unfortunately, very few countries have reached that target, and we understand that many challenges, the crisis, all sorts of challenges around. But I think we should aim at that, keep pushing towards that goal, and lift our people. A healthy country drives economic growth. It's often not the other way around. People think when you grow economically, you become healthy. But the data around the world has shown that actually, if you have a healthy population, that in of itself drives the country forward into economic development.
Well, in the moment the interview therefore comes to an end, you are from Nigeria. Nigeria has very great people known globally as the country's ambassadors. I can talk of Ngozi Muela Ogunjumbi, who is at the World Trade Organization. I can talk of Davido in music. I can talk of others, or the president of the African Development Bank, Adesina, and others. They are fantastically doing well. You are one of Nigeria's health ambassadors. How did your experience as an epidemiologist in Nigeria help you manage the World Health Organization, the position where you are today in driving the sector in which you are managing?
So, Charles, I don't think, it's not just Nigeria, all over the continent, the enterprising Africans driving many sectors of endeavor. And, you know, I would say across West Africa specifically, and even up to Cameroon, you know, we're driven by the same thing. We have the same socialization mostly. You know, it's a rare privilege. Every day I sit down in Geneva, I recognize that just by my position there, I represent the hopes and aspirations of millions of Africans. So I take that responsibility very seriously. And I hope that by our actions and what we do, we're able to contribute to the global growth of the health industry.
Finally, what is the health strategy of the World Health Organization for possibly the next 5 to 10 years when you see how COVID-19 reshaped the way we should be managing situations around the world?
COVID has been both an opportunity in certain ways because it has lifted the attention on the health sector generally in many countries, but it has also been a big challenge, apart from the millions of people that we lost around the world and the impact on the economy. I think people have come out of this really tired of what they had to do to get out of this pandemic. So in a way, we want the problem to go away and hope that just by wishing it, the risk of emerging infections has disappeared because we've gone through a pandemic. Unfortunately, the risks of these viruses remain with us and we have to stay on the ball. So WHO is pushing very hard for us not to drop the ball, not to lose the investments that every country made in its health sector during the pandemic to increase its capacity and to make sure that the investments, some very hard investments made in the last few years, are there to serve us into the future. Whether it's human resources, whether it's laboratory infrastructure, many countries built up their health sector, and we have to make sure that those investments stay to serve us, not just today, but into the future.
And with that, we conclude the interview. The Assistant Director General of the World Health Organization, Nigerian-born Chikwe Ihekweazu, thank you very much indeed for being my guest on the program.
Thank you, Charles. All the best to the people of Cameroon. Thank you.
You are welcome.
The International Relations Institute of Cameroon, this Wednesday, August 7, 2024, the day to welcome yet another special guest in a special manner by the choir of the International Relations Institute of Cameroon. The special guest is the United Nations High Commissioner for Human Rights, Volker Turk, in the country and on the campus of the International Relations Institute of Cameroon on the invitation of the President of the Republic, Paul Biya.
Cooperation between the United Nations High Commissioner for Human Rights and Cameroon covers several key areas, including the promotion and protection of human rights, the monitoring of violation of all kinds, and capacity building for national institutions. The United Nations High Commissioner for Human Rights closely monitors the human rights situation in the crisis regions of our country.
The United Nations High Commissioner for Human Rights is at the oldest and the largest school of diplomacy, Africa south of the Sahara, which has trained plus 10,000 diplomats in more than half a century to deliver a talk on human rights.
To this end, it publishes reports on developments in these situations and proposes solutions to government authorities to protect civilians. The High Commission also provides training to Cameroon security forces on the respect for human rights, particularly in the context of peacekeeping operations and counter-terrorism activities. Collaboration with the civil society is also important. Human rights awareness and education programs are implemented to inform the public and promote a culture of respect for human rights.
Today, more than 100 million people globally suffer from human rights violations in an international context increasingly becoming hostile to the promotion of human rights and their preservation.
Human rights awareness and education programs are implemented to inform the public and promote a culture of respect for human rights. For its part, the government of Cameroon is committed to facilitating the working conditions of the High Commissioner for Human Rights, Regional Office for Central Africa. This support is multifaceted, covering both administrative and consular facilities, including privileges and immunities. The recent offer of the premises to accommodate the new headquarters of the office, free of charge, by the head of state also form part of this governmental support. All these actions contribute effectively to the emergence of a society characterized by greater freedom, respect for others, and the consolidation of the rule of law, as constantly advocated by the head of state, His Excellency Paul Biya, which are necessary for the emergence of our country in 2035.
The discourse of the United Nations High Commissioner for Human Rights, Volker Turk, in Cameroon for the very first time focuses on the challenges facing the Charter of Liberty in contemporary times.
The impacts of the triple planetary crisis of climate change, biodiversity loss and pollution continue to ripple dangerously across the globe. And locally, for example, the Lake Chad Basin is experiencing drought, erratic rainfall, and increasing desertification, also triggering tensions and violence, including between herder and farmer communities. When we step back and look at the world today, we see polarization and divisions between countries on the global stage, but also within communities, which are becoming sometimes more entrenched and hardening into a mentality of us versus them, which essentially closes the door for dialogue. Hate speech and its corrosive effects on social cohesion and stability is proliferating.
The conference at the International Relations Institute of Cameroon is attended by students, diplomats, the academia, human rights advocates, and officials from the Cameroonian Ministry of Foreign Affairs, as well as other government agencies.
Corruption remains a massive issue in all regions of the world. There is also a troubling resurgence in unconstitutional changes in, or conversely, clinging on to power. Opaque electoral processes are on the rise, as are frustrations with state institutions that are considered to be neither representative nor effective. Crackdowns on peaceful protests and attacks on human rights defenders and journalists are growing, particularly in the context of elections, all against a backdrop of virtual impunity. Geopolitical quarreling and posturing, and frankly, too much warmongering and not enough peace building, as if the fundamental right to peace was forgotten. This is indeed a grim picture of the world today.
The United Nations High Commissioner for Human Rights identifies hate speech, corruption and wars as fuels for the abuse of human rights worldwide.
But I think we can and must turn things around, and we have the tools at our disposal, starting with the fundamental principles and values that underpin our international system, including and especially human rights. We must reclaim human rights as a problem-solving tool for more peaceful, for more sustainable and more equal societies. And I would like today to touch upon 3 areas where human rights are critical to solving some of our deepest challenges.
Crisis-hit regions of Cameroon, like the Northwest, the Southwest, and the Far North region, have been seen of recent as areas with high risk for human rights violations in the country, with the presence of non-state armed players.
There is a myth that focusing on human rights in the context of mediation and peacemaking can be an obstacle to such processes, that emphasizing violations, legal standards, and blaming perpetrators can stand in the way of moving forward, of securing the political will needed for peace agreements to be negotiated and accepted. It is more than time to put this myth to rest. On the contrary, human rights help us to get closer to peace. Human rights monitoring and reporting, including contemporaneously, can establish the facts in the midst of the fog of war, and objective information, truth-telling, and agreement on common history are essential if peace is to be sustainable. Human rights also keep the focus of peace processes on people. With their basis in the dignity of each human being, human rights respond to perhaps the single most challenging part of building peace: for all to see and fully grasp the humanity of the other. In too many conflicts today, that is unfortunately lost.
At a time when the United Nations Central Africa Regional Office marks 20 years of existence, the United Nations High Commissioner for Human Rights moves to the Bastos neighborhood in Yaoundé for the inauguration of their new regional head office.
Human rights also means accountability, which can take different forms depending also on the needs of the communities concerned. The pillars of transitional justice processes, truth, reconciliation, guarantees of non-repetition, and institutional reforms implemented through judicial and non-judicial means can be tailored to each context specifically and constructively to navigate the painful legacy of human rights violations. Moreover, the human rights framework can help design a negotiation agenda that includes all parties needed to make peace last in the long term and to rebuild the social fabric. In so many situations around the world, women's groups have not been involved in peace processes, and we see the consequences of it, just to give you one example. Ensuring equality for all, inclusion and participation are crucial to dealing with the past in order to move forward. If one looks back the last couple of decades, the series of peace accords throughout the 1990s, from the Dayton to Guatemala and Cambodia, demonstrated the importance of integrating human rights. Indeed, the Cambodia process resulted in the establishment of a UN Human Rights Office. My office's involvement in the negotiations in Colombia, for example, helped to anchor the 2016 accords in human rights and to address long-standing issues such as discrimination and violence against women, indigenous peoples, and people of African descent. And we ensured the meaningful inclusion of victims' voices, including of women.
The ceremony is attended by cabinet members, including the Minister for State Property, Surveys and Land Tenure, Ihekweazu. The government is officially represented at the ceremonial by the Minister Delegate to the Minister of External Relations in charge of cooperation with the Commonwealth, Felix Mbayu.
But I think we can and must turn things around, and we have indeed, as I said before, the tools at our disposal. I wish to congratulate this institute for having been selected as the academic partner for the preparatory training component of the French-speaking UN Human Rights Office Indigenous Fellowship Program, and which will empower effectively to advocate for their rights and contribute to their community's socio-economic development. Promoting human rights and finding our way through our global challenges must be nothing less than a collective endeavor. All actors, state, institutions, civil society, the private sector, institutes like this one, international institutions like my own office, it is in all our interests to work towards and to ensure an equal, just, sustainable and resilient society.
The inauguration of the new Central Africa Regional Office of the United Nations High Commission of Human Rights marks another high point for the cementing of efforts for the promotion and upholding of human rights in Cameroon, a delicate mission.